everyone. Today we are going to be demonstrating 3 assessments that can be used to assess your client's fall risk. Throughout these assessments, we're going to be following the CDC's Steady Tools guidelines to walk you through each of these assessments. This first one that we're going to show you is the Timed Up and Go test, also known as the TUG. This assessment is typically used to assess the client's mobility, and it is important throughout the assessment that the therapist observe the patient's postural stability, their gait, their stride length, and their sway.
Now we're going to be demonstrating the TUG. So, first thing you're going to do is you're going to instruct your client. So, when I say go, you're going to stand up and walk at a normal pace all the way to this line. You're going to turn around and then sit back down. So for the assessment, all you're going to need is a chair, a stopwatch. You can use an electronic stopwatch or a mobile device, and then a way to mark 10 feet away. So, are you ready? All right. When I say go, walk there and then back. Ready, go. Awesome job. Some things to note about this assessment is you're going to start the timer once the patient stands from the chair and stop it after they return back to their seat. Also, you're going to record the time in seconds. A time greater than 12 seconds, an adult is considered a fall risk. The next assessment that we will be doing is the 30-second chair stand test. For this assessment, it can also be used to determine fall risk, but it's also used for leg strength and endurance. Scoring for this assessment is based on gender and age.
Next, we're going to be demonstrating the 30-second chair stand. So for this one, all you're going to need is a straight back chair without any armrests, and then an electronic device or a timer that can keep the time throughout the assessment. So first you're going to instruct your client and tell them the directions. You're going to have the client sit in the middle of their chair with their feet flat on the floor at all times. And next you're going to tell the client to place their hands across their shoulders, on opposite shoulders, and then cross at the wrists. And next they're going to just be sure to keep their arms against their chest the whole time and their back against the chair. And then when I say go, I'm going to have you raise from the chair and stand up all the way. And then they're just going to sit back all the way back in the chair. And then you're going to repeat this for 30 seconds, and I'm going to time it. A few side notes for the assessment that we just completed is to be sure to stand next to the client throughout the whole assessment, just for some safety precautions. And once the timer is going for that 30 seconds, you should be counting the number of times that the client stands up fully from their chair and sits back down. If the client is about halfway up but the timer goes off, still count that last stand. The third assessment that we are going to be demonstrating is the 4-stage balance test. This test is used to assess static balance, and all you're going to need is a stopwatch. For this one, there are 4 standing positions that progressively get harder as they proceed. So before you begin the assessment, you should describe and demonstrate the positions to the client before you have them do them. And just be sure to stand next to the client throughout the assessment in case they need some assistance. And if the patient can hold a position for 10 seconds without moving their feet or needing support, then you can go on to the next position. But if they cannot, then you need to stop the test. Patients should not use an assistive device such as a walker or a cane throughout this assessment, and they should be keeping their eyes open the whole time.
Now we're going to be demonstrating the first 2 positions. So for the first position, you're going to have the client place their feet together. For this position, they can have their arms either out or by their side, whichever they would prefer to help keep their balance, and they're going to hold this position for 10 seconds. If they're able to complete this position, next you're going to have them place their big toe in the instep of their other foot. So putting it right kind of in that arch of your shoe, and allow them to hold this position for another 10 seconds.
The third position is called the tandem stand. So this stand just requires you to stand with one foot in front of the other, so the toes touching the back of the heel. And one side note for this one, if the client is unable to hold this one for 10 seconds, then they are at risk for falling. So you'll just have the client stand in this position for 10 seconds. And then the last one is to stand on one foot. So you'll have the client stand on one foot for 10 seconds, and that is the end of the assessment. One side note for this assessment is when you are starting each position, you're going to let the client know by saying ready, begin, and you're going to start the timer, and as the 10 seconds is up, then you will say stop to let them know that the client is finished. Once they have completed the 10 seconds, then you can record their seconds on the timesheet, and if it's less than 10 seconds, still record the time.
All the assessments and tools we used today can be found at www.cdc.gov/studywithani. Thanks for watching.